both eyes out like that. Unless they had a cranial nerve problem. So this kind of is a drawing that shows another version of, similar to that other chart. So this would be the, let's see, that would be the left eye. Because here, so the medial rectus is going to turn the eyes in, lateral rectus is going to turn them out, and then this superior oblique here, that's this one, it has a little hook that it goes through. Okay? So that's on the back of the eye. So if you have the eyes round like this, something's pulling on the back. If it pulls on the back, the front end of the eye is going to go down. So even though it's a superior oblique, it's going to point the eye down. So it would point it down and out. Okay? So it's pulling the back side of the eye like this. If this is the right eye, it's pulling the back side down, so it's going to point that eye down and out. When the muscle contracts, if that muscle is weak, then it's going to go the opposite direction.
Which cranial is that superior oblique?
The fourth. Trochlear. So this one, first we talked about the third was oculomotor, which does most of the muscles, except for the lateral rectus, which is the sixth, and then the trochlear, which does the superior oblique, which is the fourth. So sometimes, in kids or something, if their eye is not positioned straight, then they're going to maybe turn their head or something to line the eye up. So they may be interpreted as a problem with the neck, or like torticollis, which is where the SCM spasms up like that. So somebody may be doing that with their neck to compensate for problems with their eyes, with their eye muscles. So then we skip cranial nerve 5 when we go to 6, which is abducens. So abducens sounds kind of like abduction, right? Which is what it does, is it abducts laterally, turns the eye out. So if there's a problem with the muscle that turns the eye out, then it's going to overcompensate and it's going to turn in. All the other muscles will take over, so the eye is going to be deviated in. If it's affecting both sides, you have a cross eye, or if it's just one, one eye would be pointing straight and the other one would be pointed in. Okay, so you're going to have more problems with double vision with this type of thing in all different directions, unless you're going towards the affected side. So the way that you're going to do these ocular or eye muscle movements is you're going to have the patient looking straight ahead, and then you're going to say, follow my finger with your eyes, don't move your head. So you have them look up like this and that, over to the side like that, and then also towards the center like that. Okay. And then you'll notice that, and then you can do it with one eye. Like on some of the videos on that nerve testing site, or neurology exam site, it shows people where they're trying to move their eye and they're not able to go certain directions. Okay. So if your lateral rectus isn't working, you're not going to be able to turn your eye out to the side like that.